Hello everyone, I am Dr. Fatima Tuzaira, consultant dermatologist at New Roots Hair Clinic, Hyderabad. Today we will be talking about the medicines and the supplements that help in the hair growth. The hair thinning and hair loss may be temporary or permanent. It may be genetic or due to hormonal imbalance or sometimes due to neglected underlying medical conditions. You need to choose a treatment regimen to avoid the further hair loss and to regain the hair growth as soon as possible. Confer this with your doctor to first know the cause of your hair loss and to get a treatment plan as soon as possible suitable for you. There are several medications that trichologists prescribe to prevent the hair thinning and slow down the hair loss and restore the new hair growth. If you have an underlying medical condition, you need to know it first, get diagnosed and get the treatment for it first. If you are diagnosed with diabetes or thyroid irregularities, you need to be treated for that in order to restore the new hair growth. You can also experience the hair loss if you are on certain medications like those of the arthritis, heart diseases, gout, depressions, cancer medications. All these can lead to the hair loss. Your doctor will advise you how to circumvent the problem. He may alter the medications or change the dosage. Confer with your healthcare provider. The common medicines which are used for preventing the hair loss are topical minoxidil, finasteride, oral dutasteride, and the finasteride, spironolactones, and many others. These medicines help to regrow the hairs as well as slow down the hair loss. But you need to have a dedicated treatment for at least 4 to 6 months of time. But taking these medicines on your own is not advisable. Discuss with your trichologist, understand the pros and cons of each medicines, and then you take what suits you best. Let's discuss now the supplements that encourage the hair growth. Iron. The iron boosts up the blood circulation tremendously and increases the huge amount of oxygen to the hair roots. This encompasses the increased hair growth. Calcium. Calcium provides a healthy cellular structure to the hairs. It plays a pivotal role in the synthesis of hormone that boosts up the hair growth too. Ensuring that you have a good amount of calcium every day is very important to have a healthy head of hair. Biotin is an integral aspect of the protein manufacture and contributes in a large way to healthy hairs. The selenium wards off the oxidative damage from the hair follicles and prevents the inflammation of the scalp. It encourages the speedy hair growth. The folic acid greatly enhances the volume of hair, encourages the hair growth and slows down the hair loss. Folic acid facilitates the keratinization of hairs in the growth stage. Zinc as a mineral helps in the hair growth and augments the keratin in the hair shafts. Magnesium, it intensifies the blood flow to the hair follicles and halts the hair loss. This mineral also anchors the hair follicles to the scalp very strongly by fortifying the keratin structures. Magnesium balances the hormones in your body and ensures a wonderful hair growth. The vitamin B12, it brings about lot amount of oxygen to the roots of the hair follicles. Vitamin B12 increases the production of red blood cells and these RBCs supply oxygen to the hair follicles, which in turn stimulates the good hair growth. The other supplements which help in the hair growth are omega-3 fatty acids, antioxidants, ginkgo biloba, amino acids, and coenzyme Q10. Coenzyme Q10 encodes for the gene that is responsible for the keratin of the hair. So knowing all this, what is important for you? Get the professional help soon. Confer with your trichologist, know the cause of your hair loss and start the treatment right away. Your doctor might ask you to carry out a few blood tests if necessary. At the hair clinic, we help you provide with the best hair growth and slow down the hair loss. There is an expert team of the trichologist who will help you understand what treatment is best suits for you. So how long it takes to grow the hair back once you start on the treatment? Once you start the treatment, it takes a minimum period of 4 to 6 months. The hair growth varies from person to person and some individuals might experience a more time for the increased hair growth. Patience and regularity is the key. The hair grows at a rate of approximately 6 inches a year or roughly a half inch per month. Meet your doctor and get the help very soon. I hope this video was helpful for everyone. I'll see you in the next video. Till then, take care.